Welcome to our next 3 questions with a career professional. I'm really excited today to be joined by Allyssa Miller, Archmere class of 2009, who's going to talk about her career in nursing. Allyssa, do you want to introduce yourself?
Hi, as you said, I graduated in 2009 from Archmere. I am a registered nurse at Christiana. I've been there since 2013. So, just kind of my backstory or background, as you said, I graduated in '09 from Archmere, and Archmere did such a great job preparing me for just college and life in general. I always kind of knew I wanted to be a nurse, or at least somewhat in the healthcare field. My mom's a nurse, so I kind of grew up around it, so that kind of helped. But starting off at Archmere, I tried to stay like towards my main focus being on like the science classes, knowing that I wanted to be health related. And Archmere does such a great job, whether you do the honors, AP, or just regular, whatever class you're in, they prepare you so well. So just obviously with my Archmere background, started out great. And then I went to the University of Tampa. I graduated there in 2013. I applied directly to their nursing program, which was 4 years. Most programs are 4 years for nursing. And it is a little bit different between some colleges, whether you go right into the nursing program or you kind of do like a pre-nursing degree, I guess, and then usually sophomore years when you like are applying for the nursing program, if we do it that way. University of Tampa did the pre-nursing, so I did just like 1 year of just general education and then applied my sophomore year. Thankfully I got in and it was great, and then we started all the nursing classes. One thing that I did really enjoy about the University of Tampa was that they do a lot of clinical experience throughout your all your classes in your semesters, where some schools don't do clinicals till like the end of the, I guess, senior year. So that's something to kind of keep in mind as well if you know that you're interested in a nursing program. And then after I graduated in 2013, I started at Christiana, so right in Newark, stayed I came back to Delaware. And I started on a medical floor. So that's just like you have 5 patients. They're pretty stable for the most part. And you're able to give like medications, whether it's IV or by mouth or anything like that. And then just kind of keep a close eye on them, make sure they're feeling okay. They're usually there for a couple days and then they go home. In 2015, I transferred to the medical intensive care unit, which is where I still work. I absolutely love it. It's great. We have 2 patients. Sometimes it is a 1-to-1 patient, depending on how sick they are, but usually 2. And they're pretty sick. So it's definitely something that keeps you busy, keeps you on your toes. You're always thinking, kind of always trying to anticipate what's going to be coming up next for these people. So that's kind of my backstory, how I got there. I kind of just went straight through, which was great. I didn't have any gap years or have to do anything like that, which is totally fine if you do, if you want to figure out what you want to do, because it's important to know, what you want to do with your career. But it's been good so far. And like I said, I've been into the medical intensive care unit since 2015 and don't really have any other plans to go anywhere just yet. But it's definitely a great job.
Wonderful. Well, you gave us a great idea of your educational and career history. I'm curious, Allyssa, given that this is being recorded in January of 2021, what impact COVID has had on your experience? Have you been called to the COVID floor, if you will, or to help with that? Have you had any COVID patients, any of that sort that you would want to share?
Sure. We are the COVID ICU, so we are right up in it. It's been a rough year for sure. A lot of learning curves, which we're getting through. We've definitely the first couple months, I guess, March, April, they were rough. Didn't know what we were handling. Nobody did. So we all were kind of in it together to learn. Our doctors are great. They were right there with us, trying to help us learn and make sure that we were staying safe. So as time's going on, it's obviously not getting much easier, but at least we know how to prepare for it and manage these patients a lot better. We still currently are usually about 75% COVID in my unit. And then there's about 3 or 4 other units now that handle the COVID patients as well.
Okay.
So it's been interesting, but we're getting through it. And now that the vaccine's out, hopefully it starts to kind of settle down a little bit, and we got through the holidays and everything like that. So we'll see, but it's definitely been a learning curve, which is great about nursing because you're always learning. Ideally not in a pandemic, but you are always learning, and it's great.
Absolutely. Have you been able to get your vaccine first or second shot? I know Christiana also was getting a lot of attention for all the wonderful refrigerators that were necessary for one of them. So I did see that on the news, but were you able to get your vaccine?
I have not. I actually ended up getting COVID about a month ago.
Okay.
So they're recommending to wait about 90 days after having COVID. So I've for now putting it off.
Okay.
I do plan to get it once I am eligible.
Well, hopefully you're fully recovered, feeling great. Thanks again. So Allyssa, and this might be different, and if you want to answer from a pre-March perspective or a current perspective, but can you give us an idea of what a day in your life looks like when you arrive at the hospital, when you leave at the hospital, what takes up your time from the beginning to the end?
Absolutely. So I work straight night shift by choice.
Mhm.
Usually when you're starting out, you do day midnight, so you work day shift and night shift, but I'm straight night shift. So I work 7 p.m. to 7 a.m. And it's a long 12 hours, but they surprisingly go quickly at the same time. When we get to work at 7, we start report. So whether you have 1 or 2 patients, you just get a quick background, what's going on with them, where they're kind of at with their stay, and how they're doing. From there is when you kind of go through their chart, kind of anticipate what you think your night might look like, what you have to do throughout the night, whether it's different procedures or different tests they have to go to or something like that. Whether it's night or day, people are still going all over the place getting things done. So then usually I take about 20 minutes to do all that. Around 8 o'clock, I'll get started seeing my first patient. From there, I kind of do like an assessment from head to toe, see how they're doing. Our patients, the majority of them are on full life support. They're on ventilators to help them breathe, medications to help support their blood pressure or heart rate. So there's a lot going on that you kind of have to really take into perspective of the whole clinical picture so that you're able to care for these patients properly. And so with that, with what's going on, do your assessment, see how they're doing. If you need help or anything or have a question, our residents are always right there. So there's a lot of communication with them, which is great. And then after that, you give them their medications, kind of get them fixed up, repositioned, however, like cleaned up a little bit. And then go to your next patient, or if you want to chart, or however, everybody kind of has their own little different routine. But like I said, usually 2 patients. So we'll see the first, then see the second. To kind of prioritize which patient you go to first is usually I try to knock the patient out that's not quite as sick, so I can be like in and out more or less. And then if I have to spend, because sometimes you'll get stuck in your room, especially the COVID patients right now, you can be in your room for up to like 2 hours just trying to get them kind of stabilized. So you don't want to leave your other one just kind of hanging without being seen for so long. But luckily, I work with a great group of nurses as well. So if you are like caring for one patient who's not doing as well, they're there to help you with your other one, which is great. But from there, we have to see our patients every 2 hours. Since they are so sick, they have to be seen frequently, if not more than 2 hours. And they have medications pretty much throughout the entire night. So that's kind of more so if you're at the bedside. With my current unit, we have the nice flexibility of once you're there for a little bit of time, you have like other roles you can do. So we do something called like rapid response team, which basically you carry a pager. It's you and usually there's 2 of you, which is nice to have some help. You carry a pager, and if somebody throughout the entire hospital isn't doing as well, that bedside nurse will call you and say like, I need help. I need you and a resident to come and kind of help me manage this patient. So that's really interesting because you never know what you're going to walk into, whether it's somebody having a stroke or a seizure or a heart attack, bleeding, like pretty much anything under the sun you can kind of walk into, and you're like, all right, let's figure this out. And luckily, like I said, you have a resident there too, so you're not by yourself. And if you need help, I can call like my other rapid response team nurse, and we kind of figure it out together. But so that's always something that's interesting too. So if you're in that role for the night, you don't have a patient assignment, and that's just kind of what you do throughout the night, which is fun. Or we also do like a charge nurse position, which is usually if you've been there for a couple of years again, and you don't have a patient assignment, but you just kind of oversee the entire unit, which it's can be busy, can be kind of a little bit more laid back, but either way, you need to know what's going on with every patient, who has what patient, like nurse wise, and if they might need help, and kind of just see what's going on, if there's patients that go out of the unit or patients that come into the unit, because there's always admissions coming in and different like transfers from other hospitals or stuff like that. So you kind of need to be the one to plan what's going on around the unit as well, and then relay that to management the following morning. So it's never, the nice thing about being a nurse is like, you might not have the same patient assignment 2 days in a row, or even like throughout your shift, you might get switched up too. So it's never the same thing over and over again. So your days are always different, which it's fun because you don't get bored, more or less. And like I said before, like you're always learning and there's something new going on, and it's very interesting.
Absolutely. We in after career day yesterday, we talked to students about career competencies, and one of them is problem solving. And it seems like a lot of your job revolves around problem solving, figuring out what's going on, how do we solve it, who do we need help from, potentially team kind of collaborative. So
Right.
it's nice.
Absolutely.
Absolutely.
Yeah, it's definitely, nursing is definitely, I mean, you have your patients to manage, but you're never by yourself by any means. You always have your coworkers for support, or management, or doctors, respiratory therapists, all of it. Which is great.
Absolutely. If a student wanted to learn more about nursing, what could they do? What would you recommend to best prepare them? This could be academic or extracurricular.
As I kind of said before, science classes are huge. I know colleges really do look at your science classes, my goodness. And if you're not in honors, if you're not in AP, it's not a big deal. As long as like you're taking science classes and doing well in them. Biology is huge. I know when I was at Archmere, there was an anatomy and physiology class, like a extracurricular kind of thing, which if any sort of healthcare interest, probably look into something like that. If you have like psychology, sociology, anything related to the body, mind, they're huge. And then volunteering is big, whether it's just like here and there or weekly. Any way you can kind of get your foot in the door. I know Christiana has a huge volunteer program for students. AI does as well, DuPont. And then I'm sure like nursing homes, any sort of medical aid unit. I'm sure, especially right now, they're probably looking for any sort of help that they can get. American Red Cross, I think online there's like a volunteer page where if you want to look for something that's going on, an event, which might be a little bit more difficult for like events right now. But like I said, hopefully with the vaccine, everything will start to kind of slightly go back to normal, and more events will be happening, and more opportunities for volunteering. And then other than that, just try to like research any sort of nursing program that you might be interested in. It's in different schools, and kind of see how their curriculum is going if you were to get into their nursing program. It's just nice to kind of see, like I was saying before, some schools have clinical experience from the beginning and some kind of wait till the senior year. Either way is fine, you're going to be learning a ton. But I know some people, like myself included, I learn a lot more hands-on. So having the clinical experience throughout my nursing program with my classes was great, because I was able to learn in the classroom and then directly go put that to the bedside and learn, like, oh, that's what that means. So just to kind of have an idea. Obviously, you don't need to be like super like into seeing what exactly each nursing program has, but just to get a brief overview, I guess, more so.
Yeah, absolutely.
Yeah.
And my bonus question, Allyssa, is always, what's the best piece of career advice that you've gotten throughout your career that you would pass on to an Archmere student?
That would probably be make sure you like what you're doing. You're spending a lot of time with your career, your job, and you don't want to be doing something that you don't like. Especially like in the middle of a pandemic, if I didn't love nursing, I don't think I would still be sticking with it. And just really make sure that you love what you do. And if you don't love it, then you can find something else to do. And you don't want to be not looking forward to going to work every day. Like it's so important to maintain your happiness, both like away from work and at work, so that you can, be the best you, more or less.
Great. Well, thank you so much for your time, Allyssa. We greatly appreciate you passing on this advice to our students. So thank you so much.
You're very welcome. Thank you for having me. It's been great.